So our presentation is on the challenges of interprofessional collaboration, and it's going to be me, Emily, and Maggie. So the three main challenges that we're going to discuss are personal factors, role delineation, and organizational factors. So within personal factors, we're going to go into the communication styles, medical-oriented approaches, lack of trust, and lack of wanting to grow as a team. So for our communication styles, there are 4 different communication styles that was discussed within an article talking about different gender roles for healthcare practices and how healthcare professionals treated women more than they treated men. And they found that healthcare professionals tended to use these communication styles more with women, and it should be overall generalized to all populations so that there'll be better communication in general. So the 4 are social behaviors, verbal attentiveness, demonstrating concerns, and disagreement. Social behaviors could look like eye contact, not interrupting when someone's speaking, smiling. Verbal attentiveness could look like agreeing, uttering. That's kind of like, yeah, okay. Demonstrating empathy and paraphrasing. Then we have demonstrating concerns. So physically showing worry on your face, providing reassurance and support when needed, and disagreement. Providing respectful disagreements with one another while not interrupting, making sure the other person feels validated and supportive, even though you don't agree with what they're saying. So the medical-oriented approaches and poor teamwork is going to be kind of separated, but they work off of each other. The medical-oriented approaches discusses that the patient is mainly a biological entity. They're very one-dimensional. And because of that, a lot of people who are higher up in the hierarchical system think that they can just give them medicine and they'll be okay. You don't need to talk about them in regards to like OT, PT, CNAs, that stuff. So there's a lot of miscommunications that can occur, especially coming from doctors and physicians. So they also just don't take a lot of time and attention to understand that the client is their own individualized person. Within poor teamwork, there can be a lack of understanding what the other professional means and is saying. So this leads to miscommunications and misunderstandings, thus leading to errors and some safety concerns at times. People preferring to work alone and not communicate with others, again, leading to miscommunications and also not working as a team. Hierarchies within system cause frustration. So that's like using the medical-oriented approaches with the doctors and physicians, and lack of timely communication. So some personal factors that contribute to conflicts can also be seen as humor, being half-truthful, always being overly optimistic, ignoring conflicts, denial, and sticking to oneself. So although humor can be a great way to, build teamwork with serious topics, sometimes we need to be serious. Same with being half-truthful, always being fully honest. Being the overly optimistic individual might not always be the most appropriate in certain scenarios, and that can cause frustration and miscommunication. Ignoring conflicts, denial, and sticking to oneself and just saying, like, oh, I'm going to just stay in my lane, that always leads to more conflicts. So, approaching conflicts interprofessionally and using some of the communication styles that we talked about before would be the best way to move forward.
So the next challenge that I'm going to be discussing for interprofessional collaboration is the concept of role delineation. So this is defined as the process of clearly defining and describing the responsibilities, functions, and scope of practice for a specific role or job within an organization. So the concept of clear role delineation is when team members understand their own and the other members of the team's roles and responsibilities. And then on the other hand, poor role delineation occurs when the responsibilities, functions, and expectations of the team and team members are unclear, ambiguous, or poorly defined. So when looking at clear role delineation and interprofessional collaboration, having a role established and having the whole team understand each other's role as well as their own can help lead to trust in the activities and competencies of other professions. It also can help to break down negative stereotypes of other professions by understanding what they do. You learn to have a respect for their profession, and in comparison to yours, you're respecting both sides of things. Additionally, role delineation helps with shared decision making on a team, which can help to enable that shift from a provider-driven to patient-centered care. So overall, clear role delineation contributes to interprofessional collaboration because when individuals understand what is expected of themselves and those around them, then they are more likely to be inclined to work together. When looking at poor role delineation, there are a number of things that can happen. Firstly, this could lead to confusion on the team. This is because team members might not know what tasks they're responsible for or what is expected of them if those roles of their team members are not clearly defined. Additionally, poor role delineation can lead to conflict on the team. This can happen due to overlapping or unclear responsibilities, which can lead to disagreements between members. Additionally, it can lead to inefficiency on the team. This is because tasks may be left undone due to a lack of clarity. Additionally, some people could be working on the same task at once, which would limit everyone's effectiveness to get things done, and it would just create a lot of tension on the team and confusion. Lastly, it could lead to frustration or demotivation on the team. This might occur when individuals are unsure of their roles and responsibilities in comparison to their team members' roles and responsibilities. Um, so all of this can lead to a sense of reduced team performance, productivity, and collaboration because there is such a lack of clarity and efficiency on the team. When looking at poor role delineation and interprofessional collaboration, one article that I found was a qualitative study that discussed interprofessional collaboration within fall prevention for older adults. So basically in this study, the defining roles of healthcare professionals was evaluated as a major challenge for successful collaboration for this team. The biggest theme that was found for this was due to overlapping roles on the team, which led to a sense of competition and even rivalry between professionals rather than improved collaboration. This occurred since a lot of people on the team were working towards the same goal, and since they were all kind of unsure of where they fit, there was a lot of overlap with PT and OT with fall prevention. So just working together and understanding each other's roles would have helped this team to be a lot more successful when collaborating together.
So, with organizational factors, they play a huge part in an interprofessional team's ability to collaborate. And this can look very different in various settings due to the institutional nature of organizational factors. It really is, defining the setting. So when we see in acute care, the barriers primarily identified are operational work planning, workload, procedures and protocols, system rigidity, and turnover. And there's also a history of organizational hierarchy and political struggle. So even though we would love to think that everybody is just getting along and wants to learn from the other professions and respects each other's roles, unfortunately, according to the research that's been done, lots of hospitals and the acute care, you see more of a power struggle. So this would negatively impact the team collaboration. So then in the school setting, the barriers identified were high turnover, sick leave, competing projects, lack of time and resources, and unsupportive administration. So the studies were kind of identifying that if people didn't feel supported by the administration and they didn't feel the setting was really designed in order to support interprofessional collaboration, then obviously there's going to be less interprofessional collaboration, and people tend to just feel overwhelmed with competing projects and lack of time. So they're not going to seek out having more meetings with their coworkers. So then with EI, again, it's the insufficient time and resources. This is prevalent in EI. Most people are itinerant, and it's extremely difficult to make your schedule, especially if you have kind of unexpected changes to your schedule last minute. If if the families have to reschedule and everything, it's always kind of you have to juggle moving things around. So on top of that, then having to schedule with another service provider it's more difficult, and people tend to forego seeking out those opportunities, especially because there's less financial incentive in the EI setting to have interprofessional collaboration. And then in SNF, there's less resources, but basically if if they're not implementing programs like having shared tools, training programs, and reorganization of meetings, they are, it's having a negative impact on the outcomes, as opposed to, teams where they are implementing those things. And so the theme we see throughout all of these different settings is it really comes down to the time, and the perceived or actual real support that people feel from the system or the location where they're working, and whether or not it's prioritized to set aside that time to meet with other professions. And a lot of times there's just productivity standards and people kind of feel overwhelmed, and it's not the top of their priority to, have extra meetings and just organize all of those things.